watching Shalom TV, celebrating Jewish culture. Funding for Shalom TV has been provided by the following. And by viewers like you.
Jewish Education in Media is pleased to present L'Chaim, a program that highlights the people, issues, and events of importance to the Jewish community. Now here is your host, Rabbi Mark Golub.
I'm Mark Golub, and in a moment, with a bright and articulate panel, we're going to be addressing an issue on the American scene that has created a firestorm of controversy. The issue of the government's requirement that employers provide contraception in their company health care insurance policies so that women employed by companies will have access to free contraception without having to co-pay any amount. Now, this requirement was announced by the U.S. Department of Health and Human Services as part of a new guideline within the Affordable Care Act, or what's more commonly called, especially by those who oppose it, Obamacare, the national health care package that was passed in March of 2010. Part of the Affordable Care Act is to make preventive medicine available, and in many instances free of charge, to any insured individual. And again, this would now include free contraception, which many women use for health reasons in addition to trying to prevent pregnancy. The controversy erupted, however, when this guideline was directed to institutions run by religious organizations, what are often called faith-based organizations, most specifically those run in association with or under the direct auspices of the Catholic Church, which of course has as one of its basic tenets of belief an unequivocal opposition to any form of birth control. Now, I want to make sure one thing is very clear. The original contraceptive mandate specifically excluded churches and seminaries, schools that train clergy, so that no Catholic church, and no seminary was to be required to provide contraception as part of their employee insurance policies. The requirement was never to apply to churches or seminaries because of the constitutional principle of separation of church and state and the free exercise of religion clause in the First Amendment to the Constitution, the all-important Bill of Rights. At the same time, while a church or seminary was exempt from this provision, any religious-based institution, such as a Catholic hospital, administered by the Catholic Church, which serves the general public, it would be subject to the mandate to provide for its employees health care coverage that would include contraception. And here's where the controversy erupted. For the Catholic Church and others deeply concerned with the integrity of religious institutions and the need for religious groups to be protected from government interference in matters of faith and belief, this was seen as a mandate that breached church-state separation and was a way of denying the free exercise of religion because the mandate was being forced on institutions run by religious groups and that they would go against the core beliefs of their parent churches. And again, a firestorm erupted over whether the government is free to engage in some kind of what has been described as an assault on religious freedom and religious integrity. Now, almost immediately, President Obama changed the mandate by extending the exemption to any institution operated by a church or religious institution. Here's what the president had to say.
If a woman's employer is a charity or a hospital that has a religious objection to providing contraceptive services as part of their health plan, the insurance company not the hospital, not the charity, will be required to reach out and offer the woman contraceptive care free of charge, without copays and without hassles.
The president's changing the mandate means no Catholic-related institution, such as a Catholic hospital, will now have to provide insurance coverage to their employees that includes contraception. But the president is mandating that insurance companies will, on their own, have to provide contraception free of charge and without co-pays in such an instance. To President Obama, this seemed like it resolved any problem. But to many, the problem continues to exist. And there are so many sensitive, volatile issues wound up all together in this issue. And as I've watched the public discussion unfold, especially in the media, on television, radio, on the internet, in print, there's so much misinformation and misunderstanding. And more, there's often a conflation of issues so that the critical, underlying question is buried in the firestorm of debate. So I want to separate the issues and begin this discussion with one specific question, which I'm going to ask our panel to address. Again, a very specific issue. When does the government have a right to impose public policy on a religious institution, despite the freedom of religion and free exercise clause of the First Amendment? And did the initial mandate that did cover institutions like Catholic hospitals violate the principle of freedom of religion, or did it not? And what about the new mandate, exempting religious institutions as well as churches? Does it satisfy the principle of separation of church and state and safeguard the principle of religious freedom? This is the question I want to address now to a very distinguished panel, and permit me to introduce them to you. Nancy Kaufman is the Chief Executive Officer of the National Council of Jewish Women, a grassroots organization that strives to improve the quality of life for women, children, and families by safeguarding individual rights and freedoms. Bethany Mandel is a writer and essayist in new media on conservative issues, writing for Commentary magazine. Rabbi Paul Kushner, formerly of Temple Beth Am, the Reformed Jewish congregation of Merrick and Belmore, Long Island, and Rabbi Steven Burg, managing director of the Union of Orthodox Jewish Congregations, the nation's largest Orthodox Jewish organization, representing nearly 1,000 Orthodox congregations nationwide. And it is so lovely to have all of you here. Thank you for making the trip out to sit at our round table. Thank you very, very much.